roughly half of all Americans are fully vaccinated, and another 20% are partially vaccinated and presumably will be fully vaccinated too. This is good news, but it also means that a good chunk of Americans are not vaccinated. And those people fall largely into three groups. Four groups, really. One, children who are not old enough to get the vaccine yet. Two, people who may have tried to get the vaccine but really don't have access. Maybe they live in rural areas. Maybe they live in states where the vaccine hasn't been as available, or rural areas of those states. Three are people with grave medical conditions that preclude them from getting the vaccine. This is a small group, but they have conditions where they can't get the vaccine. And four, people who refuse to get the vaccine. The problem is that the fourth category, people making a decision, are putting the other three groups at risk. But this raises a question for me. On the one hand, I am concerned about the people in those first three groups, and I hope that there's a way to keep them safe because they are now less safe because of the people in the fourth category. But how much should we care when people who have said over and over they don't want to get the vaccine get COVID? How much should we care, frankly, when they die of COVID? And how much priority should we give them in the coming weeks and months when they get sick from the Delta variant over people, not just in the first three groups, but any of us? If an older person in America gets a stroke and needs to go to the hospital and they can't get in because somebody who refused to get the vaccine now has COVID, that doesn't seem right. If you've chosen to not get the vaccine, I suppose on some level, that is a personal decision. It's a personal decision that hurts other people. But those people who have made that decision need to own that decision and be held responsible for that decision. And that means they should not get priority for care if they get sick from COVID, and they should not get any public resources to support them, whether that's hospital or Medicare or Medicaid or anything else. If you've made this decision because you're so tough and you think that some odd, offbeat thing you read on Facebook by somebody who was a high school dropout carries more scientific weight than somebody with a PhD in infectious disease research, fine, that's your decision. But then don't come to the hospital services and don't come to the public dime when you need help, and don't push somebody else out of the hospital.